you're a physical therapist and you're wondering, what are your career options? Of course, you went to school, you got an education, you've learned a lot of valuable skills, and now you may have just started your first physical therapy job, or maybe you've been in your job for many years now, and you're wondering, what options do physical therapists have beyond just direct patient care? In this video, I'm going to walk you through exactly what opportunities and options are actually available for physical therapists. See, physical therapists are highly trained. My experience with physical therapists is that they are highly ambitious individuals. A lot of times, these are the people that were athletes in college or high school that have a deep curiosity for learning and for the human body, and are generally type A individuals, meaning they have a high attention to detail. They are also really good with people. In my opinion, this also extends to occupational therapists and speech language pathologists, but for simplicity's sake, we're going to make this video for physical therapists specifically. So let's talk about what options are actually available for you as a physical therapist. And I'm going to break this down into 4 main categories. The first category, which you are already aware of, is working in the clinical setting. So working in a hospital or a practice setting. This is pretty much the traditional path. You're working in an outpatient or inpatient setting. You're hands-on with patients, often in high-pressure environments. And while this can be fulfilling, it can lead to long hours, physical strain, and burnout over time. I should also say that one of the main concerns that I hear from physical therapists that work in a clinical setting is that there's not a lot of room for upward mobility, meaning that if you start off as a physical therapist and you're 25 years old, 20 years down the line, you could still be earning pretty much the same salary and really not have progressed in leadership or earning potential. And that's one of the things that really bogs a lot of physical therapists down. It's kind of that being stuck without room for growth. And therapists specifically, these are the top students, highly ambitious ones, deeply curious, and wanting to learn and grow individuals. And so there's kind of a mismatch with the profession and who these individuals are, and specifically the lack of upward career mobility. So that's basically the first option. The second option that I see for physical therapists is education. A lot of physical therapists love teaching, whether it's instructing other students, physical therapy students, DPT students, teaching anatomy, or mentoring new grads. This path leverages your expertise and passion to help others grow and give back. And this is a path that many therapists choose to go down. The one thing about this path is also it's pretty limited in earning potential. The average salary for an educational professional is somewhere between $70,000 and $90,000. The third avenue is private practice. Many physical therapists are naturally entrepreneurial. Many PTs open their own practice. They niche down into specific specialties like sports rehab or pelvic floor rehab. This creates the flexibility and income that you're typically desiring. However, entrepreneurship comes with its own challenges, especially with the way reimbursements have changed and actually decreasing over time. This has made entrepreneurship particularly more difficult. Now, many therapists have actually started running membership-based practices where patients can actually pay a monthly fee to get services and pay for additional services as they go. This does work, but from what I've seen is that even in this model, running a sustainable business becomes hard, especially if you're not an expert at marketing or getting the word out. So the therapists that do well in this are typically very content-driven, marketing-focused, and can acquire customers quickly. And the final path, and this is the one we'll spend a little bit more time on, and it's actually the fastest growing and most exciting space for physical therapists right now. This falls under the category of non-clinical roles, as it's broadly known. That can obviously mean a lot of things because there are a lot of different non-clinical roles out there, but generally this means you're not treating patients, but you're using your knowledge in different and powerful ways. That could be working with healthcare companies, working in health tech or life science, doing sales, consulting, and operations. There's a lot of different roles that this falls into. Let's actually zoom in on this last category. Non-clinical roles doesn't mean that these are non-impactful roles. Just because you're not directly working with patients doesn't mean you're having a huge impact on people's lives. With that said, let's dive into the first area of focus. The first role we're going to highlight is the clinical specialist or medical science liaison role. These roles are perfect for physical therapists with strong clinical backgrounds. You'll work with healthcare companies to support product, education, training, and clinical trials. trials, especially in orthopedics, neurology, or rehab tech. The reason this is such a great fit for physical therapists is because you already speak the medical language. You're credible with providers and you know what actually works in real life. So how fast can you realistically transition to this type of role? What does it pay? What does the job description look like? So if you've got a few years of clinical experience and a knack for teaching, you could potentially pivot to a medical science liaison job in under 6 months. However, you'll need to position your background and skills for sales. Medical science liaison is a customer-facing role, and it requires you to have good communication skills and be willing to travel for work. These roles typically are on the higher end of the pay spectrum. Many medical science liaisons generally earn between $150,000 and $250,000 a year. Moving on to number 2, product or customer success manager. Typically, this job is with a health tech company or healthcare company. Digital health companies need experts who understand movement, anatomy, and rehab to build better products and support customers. So in this role, you'll help users get the most out of platforms, rehab devices, or even apps without ever needing to treat. The reason this job is great for so many physical therapists is because you're already great at explaining complex ideas and making them very simple to understand. You've got empathy and you know how to support behavior change. The timeline for making this type of transition could also take several months. The main thing is knowing how to speak about your transferable skills, being able to get past ATS filters, and then ultimately nailing the interview. Customer success roles generally, from what we've seen in our internal database, earn salaries between $80,000 and $120,000 a year starting out. Now, the great thing about this role is there's a lot of room for upward mobility. You can climb the ladder and potentially earn your way into a director or even C-level role after many years. The third path that many physical therapists take is sales or becoming a pharmaceutical or medical device rep. PTs have the perfect mix of anatomy knowledge and interpersonal skills. And that's why medical device companies, especially in orthopedics and sports medicine, love hiring physical therapists into sales. So the bottom line is, you know the surgeons, you understand healthcare professionals, you understand how to communicate to healthcare professionals, you understand the equipment, and you're confident in a clinical setting. You've also spent a lot of time already getting buy-in from patients. So doing sales is essentially just doing discovery, which you do all the time when you're treating patients. This path also has potentially the highest earning potential. Salespeople pretty much have uncapped earning potential. The highest earning sales reps will make somewhere between $250,000 and $500,000 a year. The fourth category we'll talk about is healthcare consultant or utilization reviewer. Health insurance companies, legal teams, or consulting firms understand the real-world applications of physical therapy care. So you might review treatment plans, consult on complex cases, or help streamline patient care pathways. This is particularly a good fit if you're analytical, you're detail-oriented, and you know what quality care actually looks like. Many of these remotes are remote and flexible, particularly ideal for parents or those who are seeking work-life balance. To sum this up, as a physical therapist, you've developed skills over time that most people never even touch. You have a deep understanding of anatomy and biomedical knowledge. You're able to communicate effectively with patients and stakeholders. You're able to problem solve under pressure, and you have a deep empathy and understanding for patients. These skills can be incredibly useful in non-clinical settings. Now, I've only scratched the surface of what opportunities are actually available for physical therapists. There's still product management, program and project management, clinical operations, and many more. These are roles that we help clinicians and physical therapists land all the time. If you're curious about what opportunities are possible for you, if you're committed to making the transition in the next 6 months, you can actually book a call with our team at Matchday Health. We help physical therapists land these jobs all the time, and we can make this path incredibly easy for you. If you're ready to jump into a non-clinical job or explore what options are actually available to you, you can actually book a call with our team at Matchday Health, and we'll walk you through your options. If you found this helpful, like this video and follow our channel for more content where you can learn about what's possible on the non-clinical side of things.